National Health Mission, NHM. Introduction. India has many health problems like maternal mortality, child mortality, and communicable diseases. To improve health services, the Government of India launched the National Health Mission, NHM. Definition. National Health Mission, NHM, is a government program started in 2013 to provide accessible, affordable, and quality healthcare services to all people, especially rural and urban poor. Objectives: reduce maternal mortality rate, MMR, reduce infant mortality rate, IMR, control communicable and non-communicable diseases, improve public health services, ensure universal access to healthcare. Components of NHM. NHM has two main components. 1. National Rural Health Mission, NRHM, focus on rural population, strengthening subcenters, PHCHC, ASHA worker involvement. 2. National Urban Health Mission, NUHM, focus on urban poor, slum health services, urban PHC setup. Key activities: maternal and child health services, immunization program, family planning services, disease control programs, TB, malaria, HIV, health awareness and education. Role of community health nurse: provide antenatal, postnatal, and child care, conduct immunization sessions, health education to community, assist in national programs, TB, HIV, etc., maintain records and reports, supervise ASHA and health workers. Conclusion: NHM plays an important role in improving the health status of people by strengthening health services and reducing mortality and morbidity. Reproductive and Child Health, RCH Program. Introduction. Reproductive and Child Health, RCH program was started by the Government of India to improve the health status of mothers and children and to reduce mortality and morbidity. Definition. RCH program is a national health program that provides comprehensive healthcare services to women and children, including reproductive health, maternal health, and child survival services. Objectives: reduce maternal mortality rate, MMR, reduce infant mortality rate, IMR, promote safe motherhood, improve child health and survival, provide family planning services. Components of RCH program. 1. Maternal health services. Antenatal care, ANC, safe delivery, postnatal care, PNC, prevention of anemia, management of high-risk pregnancy. 2. Child health services, immunization, growth monitoring, management of common childhood illnesses, nutrition programs. 3. Family planning services, temporary methods, condoms, OCPs, IUCD, permanent methods, tubectomy, vasectomy, counseling services. 4. Adolescent health, education on reproductive health, prevention of early pregnancy, nutrition and hygiene education. 5. Prevention and management of RTI, STI, early diagnosis and treatment, awareness and counseling. Key services provided: free maternal and child health services, institutional delivery, JSY scheme, emergency obstetric care, referral services. Role of community health nurse: provide ANC, PNC, and child care, conduct immunization sessions, identify high-risk mothers and refer, health education on nutrition, hygiene, family planning, maintain records and reports, support national programs. Conclusion: RCH program plays an important role in improving maternal and child health and reducing mortality in India. NCP, important, exam mein aa sakta hai, common case, malnourished child under RCH. Nursing care plan. Assessment. Subjective data. Mother says child is not eating properly, child is weak and inactive. Objective data. Low weight for age, visible signs of malnutrition, thin body, kamzori. Nursing diagnosis: imbalanced nutrition less than body requirement, risk for infection. Goal: child will gain weight, child will show improved nutritional status. Planning: provide balanced diet, educate mother about nutrition, monitor growth regularly. Intervention: advise high protein, high calorie diet, encourage breastfeeding if applicable. Give supplementary nutrition, ICDS, maintain hygiene to prevent infection, monitor weight weekly. Evaluation: child shows weight gain, improved activity level, mother understands proper feeding practices. National Tuberculosis Elimination Program. Tuberculosis, TB, is a major communicable disease in India causing high morbidity and mortality. To control and eliminate TB, the Government of India started the National Tuberculosis Elimination Program, earlier known as RNTCP. Definition: NTEP is a national program aimed to eliminate tuberculosis from India by 2025 through early diagnosis, proper treatment and prevention. Objectives: early detection of TB cases, provide free and effective treatment, reduce TB transmission, reduce morbidity and mortality, achieve TB elimination. Key strategies: DOT strategy. 1. Political and administrative commitment, government support and funding. 2. Case detection, sputum examination, microscopy, CBNAT. 3. Standardized treatment, short course chemotherapy under supervision. 4. Directly observed treatments, health worker observes patient taking medicines. 5. Recording and reporting system, proper documentation of cases, diagnosis of TB, sputum examination, chest x-ray, CBN rapid test. Treatment, free anti-TB drugs provided. DOTS therapy, categories-based treatment, regular follow-up. Prevention, BCG vaccination, early detection and treatment, health education, infection control measures. Role of community health nurse, identify TB symptoms, cough, 2 weeks, collect sputum samples, ensure DOTS therapy compliance, provide health education, maintain records and reports, trace defaulters and motivate treatment continuation. Conclusion: NTHEP plays a vital role in controlling and eliminating TB by providing early diagnosis, free treatment, and community participation. NCP, very important TB case, nursing care plan, pulmonary tuberculosis patient. Assessment, subjective data, patient complains of cough for 2 weeks, fever, night sweats, weight loss. Objective data, positive sputum test, weight loss, weak nursing diagnosis, ineffective airway clearance, imbalanced nutrition less than body requirement, risk for infection transmission. Goal: patient will have clear airway, patient will gain weight, infection spread will be prevented. Planning: improve airway clearance, provide nutritional support, prevent infection transmission. Intervention: encourage deep breathing and cuffing, provide high-protein diet, administer anti-TB drugs regularly, educate about cough etiquette, isolate patient if needed, ensure adherence to treatment. Evaluation: reduced cough and sputum, improved weight, patient follows treatment regularly, no spread of infection. National AIDS Control Program. Introduction: HIV/AIDS is a serious public health problem affecting the immune system and leading to life-threatening infections. To control its spread, the Government of India started the National AIDS Control Program, NACP. Definition: NACP is a national program aimed at preventing and controlling HIV/AIDS infection and reducing its impact on individuals and society. Objectives: prevent new HIV infections, provide care, support, and treatment to affected persons, reduce stigma and discrimination, promote awareness and safe practices. Modes of transmission: unprotected sexual contact, blood transfusion with infected blood, sharing contaminated needles, mother-to-child transmission. Phases of NACP. Phase 1, 1992 to 1999. Awareness and Prevention. Phase 2, 1999 to 2006. Behavior Change and Blood Safety. Phase 3, 2007 to 2012. Control and Management. Phase 4, 2012 to present. Elimination of HIV/AIDS. Key components: HIV testing and counseling, ICTC. Blood safety measures. Prevention of parent-to-child transmission, PPTCT. Free AART, antiretroviral therapy. Targeted interventions for high-risk groups, prevention of HIV/AIDS, use of condoms, safe blood transfusion, avoid sharing needles, health education and awareness, screening of pregnant women. Role of community health nurse, provide health education on HIV prevention, promote safe sex practices, assisting HIV testing and counseling, support ART adherence, reduces stigma and discrimination, maintain confidentiality. Conclusion: NACP plays a crucial role in preventing HIV infection and improving the quality of life of affected individuals. NCP important: nursing care plan, HIV/AIDS patient, assessment, subjective data, patient complains of kamzori, weight loss, fear and anxiety about disease, objective data, positive HIV test, recurrent infections. Nursing diagnosis: imbalanced nutrition less than body requirement, risk for infection, anxiety related to disease condition. Goal: patient will maintain adequate nutrition, prevent opportunistic infections, reduce anxiety. Planning: improve nutritional status, prevent infections, provide psychological support. Intervention: provide high-protein, nutritious diet, maintain hygiene and infection control, administer ART as prescribed, provide counseling and emotional support, educate about disease and prevention, evaluation, improved weight and strength, reduced infections. Patient shows reduced anxiety, adherence to ART, maternal and child health MCH services. Introduction. Maternal and child health MCH services are essential for improving the health of mothers and children. These services help in reducing maternal and infant mortality and promote healthy families. Definition. MCH services are the health services provided to women during pregnancy, childbirth, and postnatal period, and to children for their growth and development. Objectives. Reduce maternal mortality rate, MMR. Reduce infant mortality rate, IMR. Promote safe motherhood. Ensure healthy growth and development of child. Provide family welfare services. Components of MCH services. 1. Antenatal care, ANC, care given during pregnancy. Services, early registration of pregnancy, minimum 4 ANC visits. Physical examination, BP, weight, HB. TT immunization, iron and folic acid tablets. Health education. 2. Intranatal care, care during labor and delivery. Services, clean and safe delivery, skilled birth attendant, monitoring of labor, prevention of complications. Postnatal care, PNC, care after delivery. Services, check mother and baby, promote breastfeeding, detect complications, family planning advice. 4. Child health services. Services, immunization, growth monitoring, nutrition support, management of common illnesses, ORS therapy for diarrhea. 5. Family planning. Temporary methods, condom, OCP, IUCD, permanent methods, sterilization, counseling. Role of community health nurse, provide ANC, PNC, and newborn care. Conduct immunization sessions, identify high-risk mothers and children. Health education on nutrition, breastfeeding. Maintain records and reports. Promote institutional delivery. Conclusion. MCH services are very important to ensure safe motherhood and healthy childhood, leading to overall community development. NCP, very important. Nursing care plan, assessment, subjective data, mother complains of weakness, fatigue, lack of knowledge about pregnancy care, objective data, low HB level, irregular ANC visits. Nursing diagnosis, imbalanced nutrition less than body requirement, knowledge deficit regarding antenatal care. Goal, mother will improve nutritional status, mother will follow proper antenatal care. Planning, provide nutrition education, ensure regular ANC visits. Intervention, advise iron-rich diet, green leafy vegetables, jaggery, give IFA tablets, educate about importance of checkups, monitor weight and BP, encourage TT immunization. Evaluation, improved HB level, regular ANC visits, increased knowledge about pregnancy care. Family planning program, introduction. India was the first country to start a national family planning program in 1952 to control population growth and improve the health of mothers and children. Definition. Family planning is a method by which couples decide the number and spacing of their children according to their desire and health condition. Objectives: control population growth, improve maternal and child health, prevent unwanted pregnancies, promote small family norm, improve quality of life. Methods of family planning. How? 1. Temporary methods. A. Barrier methods. Condom, male, female. B. Hormonal methods, oral contraceptive pills, OCP. Injectable contraceptives, C. Intrauterine devices, IUCD. Copper T. D. Natural methods, safe period, withdrawal method. 2. Permanent methods, A. Male sterilization, vasectomy, B. Female sterilization, tubectomy. Benefits of family planning. Prevents unwanted pregnancy, reduces maternal and infant mortality, improves economic condition, better care of children. Role of community health nurse, provide counseling to couples, educate about different methods. Motivate for small family norm. Provide contraceptives, follow up and manages side effects. Main conclusion. Family planning is essential for improving the health and well-being of families and society. NCP unmet family planning need. Nursing care plan, couple with unplanned pregnancy, no contraception use. Assessment. Subjective data, couple says they have no knowledge about contraception. Fear or myths regarding family planning. Objective data, multiple closely spaced pregnancies, no contraceptive use. Nursing diagnosis, knowledge deficit regarding family planning methods, risk for unwanted pregnancy. Goal, couple will understand family planning methods. Couple will adopt suitable contraceptive method. Planning, provide education and counseling. Motivate for contraceptive use. Intervention. Explain different contraceptive methods, clear myths and misconceptions, provide condoms OCPs, refer for IUCD or sterilization if needed. Ensure follow-up. Evaluation couple adopts COPS contraceptive method, improved knowledge, proper spacing of children. Primary health care. Introduction. Primary health care is the first level of contact between the community and the healthcare system. It focuses on providing basic health services to all people. Definition. According to World Health Organization, primary health care is essential health care made universally accessible to individuals and families in the community through their full participation and at a cost that the community can afford. Objectives. Provide basic health services to all, achieve health for all, reduce morbidity and mortality, promote health and prevent disease. Principles of primary health care. 1. Equitable distribution, health services available to all people. 2. Community participation, people should participate in their health care. 3. Intersectoral coordination, coordination with other sectors, education, sanitation. 4. Appropriate technology, use of simple and cost-effective methods. Elements of primary health care, 8 elements. 1. Health education. 2. Promotion of nutrition. 3. Safe water and sanitation. 4. Maternal and child health care. 5. Immunization. 6. Prevention and control of diseases. 7. Treatment of common illnesses. 8. Provision of essential drugs. Levels of health care. 1. Primary level, subcenter, PHC. 2. Secondary level, CHC, district hospital. 3. Tertiary level, specialized hospitals. Role of community health nurse, provide primary health care services, conduct home visits, health education to community, immunization and disease prevention, identify and refer serious cases, maintain records and reports. Conclusion. Primary health care is the foundation of the health system and helps in achieving better health for all. NCP, important, community level case. Nursing care plan, poor sanitation in community. Assessment, subjective data. People complain of frequent illness, lack of awareness about hygiene. Objective data, open defecation, dirty surroundings, unsafe drinking water. Nursing diagnosis, risk for infection related to poor sanitation, knowledge deficit regarding hygiene. Goal, improve sanitation practices, reduce incidence of disease. Planning, promote hygiene and sanitation, provide safe water education. Intervention, educate about hand washing and hygiene, promote use of toilets, ensure safe drinking water, boiling, filtering. Organize community awareness programs, coordinate with local authorities. Evaluation, improved sanitation practices, reduced illness in community, increased awareness. Health education. Introduction. Health education is an important part of community health nursing. It helps people to improve their knowledge and change their behavior for better health. Definition. According to World Health Organization, health education is a process that helps individuals and communities to improve their health by increasing knowledge and changing attitudes and behavior. Hack aims of health education: promote healthy lifestyle, prevent diseases, improve quality of life, encourage use of health services. Principles of health education. 1. Interest. Topic should be interesting. 2. Participation. People should actively participate. 3. Comprehension. Use simple and understandable language. 4. Motivation. Encourage people to change behavior. 5. Reinforcement. Repeat messages for better learning. 6. Learning by doing. Methods of health education. 1. Individual method. One-to-one teaching. Home visits, counseling. 2. Group method. Group discussion, demonstration, role play. 3. Mass method. TV, radio, posters, banners, campaigns. Role of community health nurse. Assess health needs of community. Plan and conduct health education sessions. Use different teaching methods. Motivate people for healthy practices. Evaluate effectiveness of education. Conclusion. Health education is essential to promote health, prevent disease, and improve the well-being of the community. NCP, knowledge deficit case. Nursing care plan. Lack of health awareness. Assessment. Subjective data. People say they don't know about hygiene and disease prevention. Objective data. Poor hygiene practices, increased illness in community. Nursing diagnosis. Knowledge deficit regarding health practices, risk for infection. Goal, increase knowledge about health, improve healthy practices. Planning, Conduct health education program uses simple teaching methods. Intervention, teach about personal hygiene, demonstrate hand washing, use posters and charts, encourage participation, clarify doubts. Evaluation, improve knowledge, better hygiene practices, reduce disease incidence. School health program. Introduction. School children are the future of the nation. School health program helps in maintaining and improving the health of children and promotes healthy habits from an early age. Definition. School health program is a program that provides health services to school children to promote their physical, mental, and social well-being. Objectives: promote health of school children, prevent diseases, early detection of health problems, develop healthy habits, improve school environment. Components of school health program: 1. Health appraisal, regular health checkup, screening for defects, vision, hearing. 2. Treatment and follow-up, referral services, follow-up of sick children. 3. Immunization, vaccination as per schedule. 4. Health education, personal hygiene, nutrition, prevention of diseases. 5. Nutrition services, midday meal program, growth monitoring. 6. Healthy school environment, clean water, sanitation facilities, safe surroundings. Role of community health nurse, conduct health checkups, identify health problems, provide first aid, health education to children, ensure immunization, maintain health records, coordinate with teachers and parents. Conclusion. School health program is essential for early detection of diseases and promotion of healthy lifestyle among children. NCP, school child case, nursing care plan, school child with poor hygiene, subjective data, child reports itching discomfort, lack of knowledge about hygiene, objective data, dirty nails, unclean clothes, signs of infection, skin problems. Nursing diagnosis, self-care deficit, hygiene, risk for infection, goal, improve personal hygiene, prevent infection. Planning, educate child about hygiene, promote healthy habits. Intervention, teach hand washing technique, encourage daily bathing, trim nails regularly, educate about clean clothes, involve teachers and parents. Evaluation, improved hygiene practices, reduced infection, child follows healthy habits. Occupational health services. Introduction. Occupational health deals with the health and safety of workers at the workplace. Workers are exposed to various hazards which can affect their health. Definition. Occupational health is the promotion and maintenance of the highest level of physical, mental, and social well-being of workers in all occupations. Objectives: prevent occupational diseases and injuries, promote health and safety of workers, provide safe working environment, improve productivity. Types of occupational hazards. 1. Physical hazards, noise, heat, radiation. 2. Chemical hazards, dust, gases, chemicals. 3. Biological hazards, bacteria, viruses. 4. Mechanical hazards, machinery injuries, accidents. 5. Psychosocial hazards, stress, work pressure. Prevention of occupational hazards, use of personal protective equipment, PPE, proper ventilation. Health education, regular medical checkup, safety measures and training, occupational health services, pre-employment examination, periodic health checkup, treatment of injuries, rehabilitation services, health education, record maintenance. Role of community health nurse, assess workplace hazards, provide health education, conduct health checkups, promote use of PPE, prevent occupational diseases, maintain health records. Conclusion: occupational health services are essential to protect workers from hazards and ensure a safe and healthy working environment. NCP, worker case, nursing care plan, worker exposed to dust, respiratory problem. Assessment: subjective data, worker complains of cough and breathing difficulty. Objective data, exposure to dust, signs of respiratory distress. Nursing diagnosis, ineffective airway clearance, risk for occupational disease. Goal: improve breathing, prevent further complications. Planning: reduce exposure to dust, improve respiratory health. Intervention: advise use of mask, PPE. Provide health education, encourage deep breathing exercises, refer for medical checkup, improve workplace ventilation. Evaluation: reduce symptoms, improved breathing, worker uses PPE regularly. Epidemiology. Introduction. Epidemiology is an important part of community health nursing. It helps in understanding the distribution and causes of diseases in the community and planning prevention. By definition, According to World Health Organization, epidemiology is the study of the distribution and determinants of health-related states or events in a specified population and the application of this study to control health problems. Aims of epidemiology: identify causes of disease, study disease distribution, prevent and control diseases, plan health services. Uses of epidemiology: study disease trends in community, identify risk factors, help in planning health programs, evaluate health services, control outbreaks. Components of epidemiology: agent, cause of disease, host, human being, environment, surroundings, epidemiological triad. Levels of prevention: 1. Primary prevention, health promotion, specific protection, vaccination. 2. Secondary prevention, early diagnosis, prompt treatment. 3. Tertiary prevention, disability limitation, rehabilitation. Role of community health nurse: collect health data, identify health problems, conduct surveys. Health education: participate in disease control programs, maintain records and reports. Conclusion: epidemiology helps in understanding diseases and planning effective measures for prevention and control in the community. NCP: communicable disease case, nursing care plan, patient with communicable disease. Assessment: subjective data, patient complains of fever, weakness. Objective data, signs of infection, positive lab reports. Nursing diagnosis: hyperthermia related to infection, risk for spread of infection. Goal: reduce fever, prevent spread of disease. Planning: control infection, provide symptomatic care. Intervention: monitor temperature regularly, administer medications as prescribed, maintain isolation if needed, educate about hygiene and precautions, encourage fluid intake. Evaluation: normal body temperature, no spread of infection, improve patient condition. This answer is very important, plus concept-based NCP included, extra marks. Next, demography, important for data-based question. Just say next. Great. Now important data-based question, easy plus scoring. Demography. Introduction. Demography is the study of population. It helps in understanding population size, distribution, and changes, which is important for planning health services. Definition. Demography is the statistical study of population size, composition, distribution, and changes, birth, death, migration. Components of demography: population size, population distribution, population density, population growth. Vital statistics. Vital statistics are important data related to life events like birth and death. 1. Birth rate: number of live births per 1,000 population in a year. 2. Death rate: number of deaths per 1,000 population in a year. 3. Infant mortality rate, IMR, number of deaths of infants below 1 year per 1,000 live births. Cheshire 4. Maternal mortality rate, MMR, number of maternal deaths per 100,000 live births. 5. Population growth rate, increase in population over a period of time. Importance of demography: helps in health planning, identify population problems, allocate resources, evaluate health programs. Role of community health nurse: collect population data, maintain birth and death records, conduct surveys, assisting census work, use data for planning health services. Conclusion: demography is essential for understanding population trends and improving health services. NCP: high population, high birth rate area. Nursing care plan: community with high birth rate. Assessment: subjective data: people prefer large families, lack of knowledge about family planning. Objective data: high birth rate, closely spaced children, nursing diagnosis, knowledge deficit regarding family planning, risk for maternal and child health problems. Goal: reduce birth rate, promote small family norm. Planning: provide education on family planning, motivate for contraceptive use. Intervention: conduct awareness programs, explain benefits of small family, provide contraceptives, encourage spacing methods, involve community leaders. Evaluation: increased use of contraception, reduced birth rate, improved awareness, national immunization program, UIP. Introduction: immunization is one of the most effective methods to prevent infectious diseases in children. The Government of India started the Universal Immunization Program, UIP, to protect children and pregnant women. Definition: immunization is the process of protecting individuals from diseases by administering vaccines. Objectives: reduce child mortality, prevent vaccine-preventable diseases, provide free vaccination services, achieve full immunization coverage. Diseases covered under UIP: tuberculosis, polio, diphtheria, pertussis, tetanus, measles, hepatitis B. Immunization schedule at birth, BCG, OPV 0, hepatitis B. 6, 10, 14 weeks, OPV, pentavalent vaccine, IPV. 9 months, measles, MR vaccine. 16 to 24 months, DPT booster, OPV booster. Pregnant women, TT injections. Cold chain. Cold chain is the system of storing and transporting vaccines at the correct temperature. Importance. Maintains vaccine potency, prevents damage to vaccines. Role of community health nurse. Conduct immunization sessions. Maintain cold chain. Educate parents. Record and report vaccinations. Manage side effects. Ensure full immunization. Conclusion. The immunization program is essential to protect children from deadly diseases and reduce mortality. NCP, very important. Nursing care plan, child not immunized. Assessment. Subjective data. Mother says child has not received vaccines, lack of awareness. Objective data. No immunization record, child risk of infection, diagnosis, risk for infection, knowledge deficit regarding immunization. Goal, child will receive all vaccines, mother will understand importance of immunization. Planning, educate mother, complete immunization schedule. Intervention, explain benefits of vaccines, provide immunization as per schedule, maintain proper records, monitor for side effects, follow up for next doses. Evaluation, child fully immunized, mother aware about schedule, reduced risk of disease, healthcare delivery system in India. Introduction. India has a well-organized healthcare delivery system to provide services to all people. It includes different levels of care from basic to advanced services. Healthcare delivery system is the organized way of providing health services to the population through different levels and institutions. TASH objectives: provide healthcare to all, reduce disease and mortality, promote health and well-being, ensure equitable distribution of services. Level 1, primary level. First contact level facilities, subcenter, primary health center, PHC. Services, basic health care, immunization, MCH services, treatment of minor illnesses. Chakra 2, secondary level, referral level facilities, community health center, CHC, district hospital services, specialist services, emergency care, diagnostic services. 3, tertiary level, highest level facilities, medical colleges, super specialty hospitals. Services, advanced treatment, specialized care. Structure of healthcare system in India. Central government, state government, district health system, village level, ASHA, ANM. TASH role of community health nurse, provide primary health care, conduct home visits. Health education, immunization services, referral of serious cases, maintain records and reports. Conclusion. The healthcare delivery system in India ensures that health services reach all levels of population from village to city. NCP important, lack of access to health services. Nursing care plan, community with poor health service utilization. Assessment, subjective data. People say health services are far or costly. Lack of awareness. Objective data, low utilization of health services, poor health status. Nursing diagnosis, ineffective health maintenance, knowledge deficit regarding health services. Goal, increase use of health services, improve health status. Planning, improve awareness, promote accessibility. Intervention, educate about available services, PHC, CHC, motivate for regular checkups. Arrange health camps, coordinate with health workers, provide referral services. Evaluation, increased use of services, improved community health, better awareness. This answer is important, plus scoring NCP included equals extra marks. Next, last important one, ASHA worker. Just great. Now last but very important, direct question. ASHA worker, accredited social health activist. Introduction. To improve community health services at the village level, the Government of India introduced the ASHA worker under the National Health Mission. ASHA, accredited social health activist, is a trained female community health worker who acts as a link between the community and the healthcare system. Objectives: improve access to health services, promote health awareness, reduce maternal and child mortality, strengthen community participation. Selection criteria: female resident of village, Age 25 to 45 years, minimum education, usually 8th pass, good communication skills. Roles and responsibilities. 1. Maternal health, motivate for antenatal care, promote institutional delivery, accompany pregnant women to hospital. 2. Child health, promote immunization, newborn care, growth monitoring. 3. Family planning, provide counseling, distribute contraceptives. 4. Disease control, identify TB, malaria cases, refer to health center. 5. Health education, hygiene and sanitation, nutrition, breastfeeding. Incentives of ASHA, paid based on performance. Incentives for immunization, delivery, family planning. Role of community health nurse with ASHA, supervise ASHA worker, provide training, support in health programs, monitor performance. Conclusion. ASHA worker plays a key role in improving community health by connecting people with health services. 1. ASHA worker. ASHA, accredited social health activist, is a trained female health worker who acts as a link between the community and health system. Functions. Motivate for antenatal care and institutional delivery. Promote immunization. Provide family planning counseling. Health education on hygiene and nutrition. Identify and refer sick cases. Conclusion. ASHA plays a key role in improving rural health services. Number 2. Cold chain. Cold chain is the system of storing and transporting vaccines at proper temperature, 2 to 8 degrees Celsius. Importance. Maintains vaccine potency, prevents damage. Equipment. Ice-lined refrigerator, ILR, deep freezer, vaccine carrier, ensures effective immunization. Hack 3. IMR, infant mortality rate. IMR is the number of deaths of infants below 1 year per 1,000 live births in a year. Causes: low birth weight, infection, malnutrition. Prevention: immunization, breastfeeding, proper neonatal care. 4. Levels of prevention. 1. Primary prevention, health promotion, vaccination. 2. Secondary prevention, early diagnosis and treatment. 3. Tertiary prevention, rehabilitation, helps in controlling disease at different stages. Aqua 5. Eligible couple. Eligible couple means a married couple where wife is in reproductive age 15 to 49 years. Importance: helps in family planning services, population control. 6. ASHA incentives. ASHA worker gets performance-based incentives. Examples: institutional delivery, JSY, immunization, family planning services. Number 7. Health indicators. Health indicators show health status of population. Types: mortality indicators, IMR, MMR, morbidity indicators, nutritional indicators. 8. Functions of PHC. Provide primary health care, immunization, MCH services, treatment of minor illnesses, health education. Surveillance. Surveillance is continuous collection and analysis of health data. Purpose: detect disease early, control outbreaks. 10. RTI, STI, RTI are infections of reproductive tract. Causes: unsafe sex, poor hygiene. Prevention: use of condoms, health education. Number 11. ICDS Integrated Child Development Services, ICDS, provides services for children and mothers. Services: supplementary nutrition, immunization, health checkup, preschool education. 12. Janani Suraksha Yojana, JSY. JSY is a scheme to promote institutional delivery. Benefits: financial assistance to pregnant women, reduce maternal and infant mortality. 13. Under 5 Clinic. Clinic for children below 5 years. Services: immunization, growth monitoring, treatment of illness. Home visit. Home visit is visiting patient at home. Purpose: provide care, health education, follow-up. 15. Biomedical waste management, proper disposal of medical waste. Methods: segregation, use of color-coded bins, safe disposal. 1. Subcenter. Subcenter is the most peripheral health unit and first contact point between community and health system. Functions: maternal and child health services, immunization, family planning, health education. It plays an important role in rural healthcare. Anganwadi worker. Anganwadi worker is a community-based worker under ICDS. Functions: provide supplementary nutrition, growth monitoring, preschool education, health education. Important for child development. 3. Weaning. Weaning is the process of introducing semi-solid foods to a child after 6 months of age. Importance: provides extra nutrition, supports growth, essential for proper child development. 4. Balanced diet. A balanced diet contains all nutrients in proper amount. Components: carbohydrates, proteins, fats, vitamins, and minerals. Maintains good health. 5. Malnutrition. Malnutrition is deficiency or excess of nutrients. Causes: poor diet, poverty, infection. Prevention: balanced diet, health education. 6. Diarrhea management. Diarrhea is frequent loose stools. Management: ORS solution, zinc tablets, continue feeding, maintain hygiene. Prevents dehydration. Number 7. ORS, oral rehydration solution. ORS is a solution used to prevent dehydration. Uses: treat diarrhea, maintain fluid balance. Life-saving intervention. 8. Vitamin A deficiency. Deficiency of vitamin A causes eye problems. Signs: night blindness, dry eyes. Prevention: vitamin A-rich diet. Supplementation. 9. Fluorosis. Fluorosis is caused by excess fluoride in water. Types: dental fluorosis, skeletal fluorosis. Prevention: safe drinking water. 10. Water purification methods. Methods: boiling, filtration, chlorination, prevents waterborne diseases. ASHA worker, village level female health worker, link between community and health system, promotes ANC, immunization, family planning. Cold chain, system to store vaccines at 2 to 8 degrees Celsius, maintains vaccine potency, uses ILR, deep freezer. IMR, infant deaths 1 year per 1,000 live births, indicator of community health. Eligible couple, married couple with wife age 15 to 49 years, target group for family planning. ICDS, Program for Mother and Child, provides nutrition, immunization, preschool education. JSY, Scheme promoting institutional delivery, gives financial assistance to pregnant women. ORS, Solution to prevent dehydration and diarrhea, simple and life-saving. Malnutrition, deficiency of nutrients, causes weakness, poor growth, prevented by balanced diet. Balanced diet, diet with all nutrients, carbs, protein, fat, vitamins, minerals in proper amount. Weaning, starting semi-solid food after 6 months, essential for child growth. Vitamin A deficiency, causes night blindness, prevented by supplementation and proper diet. Fluorosis, due to excess fluoride, affects teeth and bones. Subcenter, First Contact Health Facility, provides MCH, immunization, family planning. Anganwadi worker, ICDS worker, provides nutrition, preschool education, growth monitoring. Surveillance, continuous data collection of diseases, helps in early detection and control. Number 1. Tuberculosis, TB. Introduction. Tuberculosis is a major communicable disease affecting lungs and other organs. It is a major public health problem in India. Definition. Tuberculosis is a chronic infectious disease caused by Mycobacterium tuberculosis. Mode of transmission, airborne, droplet infection. Spread by coughing/sneezing. Signs and symptoms: cough 2 weeks, fever, night sweats, weight loss, blood and sputum. Prevention: BCG vaccination, early diagnosis and treatment, avoid overcrowding. Health education. Management: anti-TB drugs, DOTS, proper nutrition, isolation if needed. Role of nurse: identify symptoms early, ensure drug compliance. Health education, prevent spread. NCP, patient assessment: cough, fever, weight loss diagnosis, ineffective airway clearance, goal: clear airway, reduce infection. Intervention: give drugs, nutrition, teach cough etiquette, evaluation, symptoms reduced, patient follows treatment. Number 2. Malaria, introduction. Malaria is a mosquito-borne disease common in tropical countries like India. Definition. Malaria is an infectious disease caused by Plasmodium parasite. Hack, mode of transmission, bite of infected female Anopheles mosquito. Signs and symptoms: fever with chills, sweating, headache, body pain. Prevention: use mosquito nets, remove stagnant water, use repellents. Management: anti-malarial drugs, fluids and rest. Role of nurse: identify cases early, provide treatment, health education, vector control awareness. NCP, assessment: fever, chills. Diagnosis: hyperthermia, goal: reduce fever. Intervention: monitor temp, give meds, fluids, evaluation. Temp normal, symptoms reduced. Number 3. Dengue. Introduction. Dengue is a viral disease spread by mosquito and common in rainy season. Definition. Dengue is an acute viral infection caused by dengue virus. Mode of transmission: bite of Aedes mosquito. Signs and symptoms: high fever, severe joint pain, breakbone fever, headache, rash. Prevention: avoid water stagnation, use mosquito protection, clean surroundings. Management: no specific treatment, symptomatic treatment, fluids, rest, monitor platelet count. Role of nurse: monitor vital signs, educate about prevention, early detection, supportive care. NCP, dengue patient assessment: high fever, weakness. Diagnosis, risk for fluid volume deficit. Goal, maintain hydration. Intervention, encourage fluids, monitor vitals, evaluation, stable condition, adequate hydration. Number 4, rabies. Introduction. Rabies is a fatal viral disease transmitted by animal bites, especially dogs. It is 100% preventable, but almost always fatal after symptoms appear. Definition. Rabies is an acute viral disease affecting the central nervous system caused by rabies virus. Mode of transmission, bite or scratch of infected animal, dog, monkey. Virus present in saliva. Signs and symptoms, fever, pain at bite site, hydrophobia, fear of water, convulsions. Prevention, immediate wound washing, soap plus water, anti-rabies vaccine, control of stray animals. Management, immediate first aid, post-exposure prophylaxis, vaccine plus immunoglobulin. Role of nurse, provide first aid, educate about vaccination, counsel patient, prevent delay in treatment. NCP rabies exposure case, assessment, history of dog bite. Diagnosis, risk for infection. Goal, prevent rabies infection. Intervention, wound wash, vaccination, education, evaluation, no signs of infection. Number 5, diarrhea. Introduction. Diarrhea is a common condition, especially in children, leading to dehydration and death if untreated. Definition. Diarrhea is the passage of frequent loose or watery stools. Causes, infection, contaminated food, water, poor hygiene. Signs and symptoms, loose stools, dehydration, weakness. Prevention, safe drinking water, hand hygiene, proper sanitation. Management, ORS solution, zinc tablets, continue feeding, IV fluids, severe cases. Role of nurse, assess dehydration, give ORS, educate mother, maintain hygiene. NCP, NCTR child assessment, loose stools, dehydration. Diagnosis, fluid volume deficit. Goal, maintain hydration. Intervention, ORS, fluids, monitor. Evaluation, hydration improved. Number 6, pneumonia. Introduction. Pneumonia is a serious respiratory infection, especially in children under 5 years. Definition. Pneumonia is an infection of lungs causing inflammation of air sacs. Causes, bacteria, viruses. Signs and symptoms, cough, fever, fast breathing, chest and drawing. Prevention, immunization, proper nutrition, avoid cold exposure. Management, antibiotics, oxygen therapy, if needed, fluids and rest. Role of nurse, monitor breathing, give medicines, educate parents, early referral. NCP pneumonia child assessment, cough, fast breathing, diagnosis, ineffective breathing pattern. Goal, improve respiration. Intervention, oxygen, meds, monitor. Evaluation, normal breathing. Number 7, leprosy. Introduction. Leprosy is a chronic infectious disease affecting skin and nerves. It is still seen in some parts of India, but is completely curable. Definition. Leprosy is a chronic infectious disease caused by Mycobacterium leprae. Mode of transmission, prolonged close contact with infected person, spread through nasal droplets. Signs and symptoms, skin patches, light or reddish, loss of sensation, nerve damage, weakness in limbs. Prevention, early detection, complete treatment, health education. Management, MDT, multi-drug therapy, regular follow-up. Role of nurse, early identification, ensure treatment compliance, educate patient, prevent disability. NCP, leprosy patient assessment, skin patches, numbness. Diagnosis, impaired skin integrity. Goal, prevent complications. Intervention, drugs, skincare, education, evaluation, improved condition. Number 8, filariasis. Introduction. Filariasis is a mosquito-borne disease causing swelling of body parts, mainly legs. Definition. Filariasis is a parasitic disease caused by filarial worms. Mode of transmission, bite of infected mosquito. Signs and symptoms, swelling of legs, elephantiasis, fever, pain. Prevention, mosquito control, personal protection, mass drug administration, MDA. HAP management, anti-filarial drugs, hygiene, limb care. Role of nurse, educate about prevention, promote MDA, care of affected patients. NCP, filariasis patient. Assessment, swelling of limb. Diagnosis, impaired physical mobility. Goal, reduce swelling. Intervention, hygiene, meds, limb care, evaluation, improved mobility. NAR 9. Introduction. Measles is a highly contagious viral disease, mainly affecting children. Definition. Measles is an acute viral infection caused by measles virus. Mode of transmission, airborne, droplet infection. Signs and symptoms, fever, rash, cough, cold, red eyes. Prevention, immunization, MR vaccine, isolation of patient. Management, symptomatic treatment, vitamin A supplementation. Role of nurse, immunization, early detection, isolation care, health education. NCP, measles child assessment, fever, rash diagnosis, hyperthermia. Goal, reduce fever, intervention, monitor temp, fluids, evaluation, temp normal. Final quick revision, all diseases. TB, airborne malaria, anopheles, dengue, Aedes, rabies, dog bite, diarrhea, ORS pneumonia, fast breathing, leprosy, skin plus nerve, filariasis, elephantiasis, measles, rash vaccine. Introduction. Home visit is an important method of providing community health services directly at the patient's home. Definition. Home visit is a planned visit by a health worker to the patient's home to provide nursing care and health education. Objectives. Provide care at home, assess home environment, health education, follow-up of patients. Principles of home visit, planned and purposeful, regular and flexible, based on needs of family, maintain privacy and respect, good communication. Steps of home visit: 1. Planning, 2. Preparation, 3. Approach to family, 4. Intervention, 5. Evaluation, 6. Recording and reporting. Advantages: builds trust, early detection of problems, better patient care. Role of nurse: provide care and treatment, health education, follow-up, maintain records. Conclusion. Home visit helps in improving health of individuals and families at community level. NCP. Nursing care plan, patient needing home care assessment, patient weak, poor hygiene, diagnosis, self-care deficit. Goal: improve self-care. Intervention: teach hygiene, provide care, evaluation, improved condition. Introduction. Community bag technique is used by nurses during home visits to prevent infection. Definition. Bag technique is a method of using and handling the nursing bag in a clean and safe way to prevent cross-infection. PASH objectives: prevent infection, maintain cleanliness, provide safe nursing care. Principles: keep bag clean and dry, use articles carefully, avoid contamination, wash hands before and after procedure. Steps of bag technique: 1. Place bag on clean surface. 2. Wash hands. 3. Open bag carefully. 4. Take required articles. 5. Perform procedure. 6. Clean articles. 7. Close bag properly. 8. Wash hands again. Contents of bag: dressing materials, gloves, soap, medicines, record book. Role of nurse: maintain asepsis, prevent infant, use proper technique. Conclusion. Bag technique is essential for safe and hygienic nursing practice in the community. NCP, infection prevention case, nursing care plan, risk of infection during home care assessment, poor hygiene, repeated infections. Diagnosis: risk for infection. Goal: prevent infection. Intervention: maintain asepsis, educate patient. Evaluation: no infection. Number 1. Biomedical waste management, BMW. Definition. Biomedical waste is waste generated during diagnosis, treatment, or immunization of patients. Types, categories: infectious waste, sharps, needles, chemical waste, general waste. Color coding. Yellow, human waste, infectious waste; red, plastic waste; white, translucent, sharps; blue, glassware. Methods of disposal: incineration, autoclaving, deep burial. Role of nurse: segregate waste properly, follow color coding, prevent infection. Conclusion. Proper BMW management prevents infection and protects environment. Number 2. Disaster management. Definition. Disaster is a sudden event causing damage to life and property. Types: NIPES. Flood, earthquake, man-made, fire, accident. Phases of disaster. 1. Pre-disaster, preparedness. During disaster, immediate response. 3. Post-disaster, rehabilitation. Role of nurse: first aid and emergency care, triage, health education, rehabilitation. Conclusion. Disaster management reduces loss of life and helps recovery. 3. Health planning in India. Definition. Health planning is the process of organizing health services to meet needs of people. Objectives: improve health services, reduce disease, proper use of resources. Key points: 5-year plans. Role of Niti Aayog, national programs. Conclusion. Health planning helps in better delivery of services. 4. National health policy. Definition. National health policy is a framework for improving healthcare services. Objectives: universal healthcare, reduce mortality, improve quality of care. Key features: focus on primary health care, disease prevention, strengthening health system. Conclusion: it guides the development of health services in India. Number 5. Records and reports. Definition: records are written documents of patient care. Reports are summaries of activities. Types: individual records, family records, registers. Importance: continuity of care, legal evidence, planning and evaluation. Role of nurse: maintain accurate records, timely reporting. Conclusion: records and reports are essential for effective health services. Definition: referral system is sending patient from one level of care to higher level for better treatment. Levels: primary, secondary, tertiary. Importance: better diagnosis, specialized care, saves time and life. Role of nurse: identify need for referral, arrange transport, follow-up. Conclusion: referral system ensures proper patient care. 7. Geriatric care. Definition: geriatric care is care of elderly people above 60 years. Problems: physical, weakness, disease, mansic, depression, social isolation, care, proper diet, regular checkup, emotional support. Role of nurse: health assessment, education, support. Conclusion: geriatric care improves quality of life of elderly. 8. Definition: rehabilitation is helping a person to regain maximum ability after illness or injury. Types: medical, social, vocational. Role of nurse: physical care, emotional support, training and guidance. Conclusion: rehabilitation helps patient return to normal life. 9. Environmental health. Definition: environmental health deals with factors affecting health and surroundings. Components: air pollution, water pollution, waste disposal. Prevention: clean environment, safe water, proper sanitation. Role of nurse: health education, promote sanitation, prevent diseases. Conclusion: healthy environment is essential for good health. 10. Mental health and community. Definition: mental health is the state of well-being in which a person can cope with stress. Common problems: depression, anxiety, substance abuse. Role of nurse: early identification, counseling, referral. Conclusion: mental health is important for overall well-being.